My name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the right and voice.
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin from Warnal.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something. Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are after treatment live with Kent, and Kent was having some voice problem, and today we are after treatment live. We did his pre-treatment live earlier, and Kent, how do you feel after treatment? Tell about yourself and your problem, what problem you had earlier, and what are the feedback you are getting and what changes you are observing. Please unmute your mic.
Yeah, it's Ken here. So I had a very high pitch voice, and it affected my work. Okay, I'm an accountant myself, and many people always address me as Mrs. on the phone, and I was very sad about that. So I then approached Sanjay Kumar, Dr. Sanjay Kumar, for a solution. Okay, and then I'm quite happy for the change so far. And when I compare the voice clip, that I recorded back in 2018, I can hear a lot of change. At least much better than before. So yeah. So there aren't any people tell me there's a difference, but they did tell me your voice sounds tired, I suppose.
Okay, so I will just play your before treatment live also. So let those who are watching this live, they will get an idea of how was the voice earlier. So I'm just going to play your pre-treatment live as well. This was on May 28, 2021. So I'm just playing that live.
So I have a very high pitched voice. My voice hasn't changed since I turned 14. I always carry this voice, and I didn't know my voice was this high until one day when I was on the phone, and that person put me on speaker.
Okay, so I was playing your pre-treatment live. Yeah, so tell your hobbies, what work you do, and tell something more so that people can listen your voice and get some idea.
Okay, so I'm an accountant, so I'm 24 years old this year, so I have worked for about 3 years. I'm nearly qualified accountant at this stage, and like every other accountant, I'm trying to finish my ACCA paper, and it is a professional qualification in accountancy. So yeah, so I'm and the change in my voice will definitely help me, to do better, to progress better in my work. Yeah. So I'm actually in the middle of the therapy, so I think my voice will be better and better, and yeah, in the next few months, yeah.
Yeah, because it was a long gap between your pre-treatment life and I thought let's do the post-treatment life. The reason was that you had some personal issue with like because of you're not getting time for the therapy, so you discontinued for long duration and then you joined. But at least I thought there are people those who have watched your pre-treatment life, so let them watch the post-treatment life as well, whatever that we have achieved it. Okay. But I hope there will be some better changes. So anyway, so the idea was to do the live what exactly today the condition is. Okay.
Yeah.
And yeah, one more thing I'll be adding. Many times some people will be having a fear like, okay, after treatment there will be relapse. So there are certain communication disorder like stammering where we have seen the relapse after the treatment. But in the pitch and the loudness correction, once we have corrected, till now we have experienced that things will be permanent once the treatment will be over. In fact, I did live of the patient whom we have treated 6 years back. Even I remember there was one live we did 15th August 2020. And after that, we did so many old patient live to whom we have treated long back. So just to create awareness like the what treatment we are giving, it will be stable. So what I have observed till now in the pitch and loudness correction, if your body respond on the therapy and you will not the therapy in the leave the therapy in the middle and you will follow the instruction, the voice will be stable. Okay, till now. But of course, in the health science, there can be exceptional situations, so that will be another issues. But based on experience, I can say that it will be stable in your case and any other patient's case also. So tell your hobbies.
Yeah. I love reading books, so I read a lot of books, and then I love jogging. So I will run 10 km every Sunday. Yeah, of course, a sunny day, Yeah. So that's what I do.
Okay, I'll check if any questions I am getting. Meantime, I'll be discussing those questions answer also. So first of all, I want to thank you everyone and thanks for watching and joining us. And today we are live with the Kent and Kent was having some voice problem and today we are before treatment live and earlier we did his pre-treatment live also. And welcome all of you again to our YouTube channel SLP Sanjay Kumar, voice therapist. So I think it has been disconnected or it's going on. I'm not sure. Some network issue I was facing. I think it's going on. I can see the some messages. Yeah. So thank you those who are watching. Salman is watching. Thank you Salman for watching, and thank you Vishal. Vishal is saying hello sir. Vishal is saying where are you from? So our center is in Bangalore. And please refer the description of this live. You'll find our website and there you can click the reach me and then you'll find our email ID, our contact number, and on the Google map, where is clinic situated. So you'll find all the details. So those who are watching, newly, those who have joined, just I will tell. Kent was having some pitch and loudness problem and we gave voice therapy to him. And today we are after treatment live and because of some personal reason he was not able to continue the therapy a very disciplined way. He had a lot of gap and all, but my idea was when I have done the pre-treatment live, let's do the post-treatment live whatever we achieve because there is a long gap. And those who are watching this live, my suggestion is just watch his pre-treatment live also so that you can compare pre and post treatment voice changes, and the link of the pre-treatment live I have given in the description of this live. तो जो लोग भी इस लाइव को देख रहे हैं मैं उनसे रिक्वेस्ट करूंगा कि आप इस लाइव के डिस्क्रिप्शन में जाइए और आपको केंट का प्री ट्रीटमेंट लाइव का जो लिंक मिलेगा उसको भी क्लिक कीजिए और दोनों में कंपेयर कीजिए और तब आपको पता चलेगा कि क्या क्या चेंजेस एक सर्टिफाइड स्पीच पैथोलॉजिस्ट, सर्टिफाइड स्पीच थेरेपिस्ट वॉइस थेरेपी के द्वारा करते हैं. तो उसमें से एक केंट की वीडियो से भी आपको एक आइडिया मिलेगा और बाकी हमारे यूट्यूब चैनल के प्लेलिस्ट को भी एक्सप्लोर करेंगे तो और ज़्यादा इन्फॉर्मेशन मिलेगा. Okay, Kent, I think some new people has joined, so I will suggest you to tell again, maybe you have to repeat what problem you had and how do you feel, where are you from, just give a small introduction.
Yeah. So I I'm from Malaysia and I'm currently based in Ireland because I went to this country to study, and now I'm working as an accountant. Okay, so I started to face a few problems, when I started to work, with this high pitch, right, high pitch voice. So I was looking for a solution, all over the internet. So I tried different ways. I tried to do humming. I tried to like loosen my neck. I tried this for
Okay, you
for a
tried.
few months, but it
Okay,
doesn't really work.
So you tried self-treatment. That I suggest don't do.
Yeah.
Okay,
Yeah.
so you tried self-treatment, but it was not helping.
Yeah, and it really didn't work. It didn't work. So I'm very lucky, okay, to find to discover, Dr. Sanjay Kumar over the internet. It's amazing, when I'm based in Ireland, like the other side of the world, and I'm still able to meet Dr. Sanjay, to cure my voice. And yeah, I think my voice has improved. That's what I think, because I listened to a few voice clips, that I sent to my parents, a few years ago, and it really surprised me, for the change. Okay, yeah, and I also use a few voice recorder like software and just to test my voice, and it really drop a few, hertz. Hertz is the unit, that you measure the deafness of your voice.
Yeah.
Yeah.
That's nice. Whatever you are telling, it's a really informative for the many people, and of course, yeah, I'm very happy, and we all are very happy. Like you are feeling some changes, and oh, sorry. So I'm very happy that you are feeling there is some change after the therapy. And again, I will inform those who are watching. We did his pre-treatment live earlier. I will play once more your pre-treatment live, so people will get an idea. Let me play once because that we did long back, and it was in May 28th. So I'll playing that.
My voice hasn't changed since I turned 14. I always carry this voice, and I didn't know my voice is this high until one day when I was on the phone, and that person.
Yeah, can't continue again. Just 1 minute. I'm opening. Has stuck. Yeah, you can continue. How you spend your time on holidays, Sunday, weekend?
Yeah. So before COVID-19, I normally hang out with my friends, walking around in the park. But since COVID-19, right, I just stuck at home, I didn't really go anywhere. So like weekend, I will normally do some reading, and I'll call my parents, back in Malaysia, and just watch a few dramas. Yeah, that's how I spend my free time. Yeah.
Okay, thank you so much, Kent, for your faith in us. I'm in India, I'm in Bangalore, India, and you are in different country. In spite of that, you took our service and you are feeling better. So we are also very happy for you. And those who are watching this video, I will again suggest to them, please refer the description of this live, and don't forget to watch his the Kent pre-treatment live, and you can compare both the live, and you will get an idea how the voice has been changed after the therapy. And if you are feeling there is a difference, please like this video, share this video, so that people like Kent can reach to a right place and they can get professional help. And when I'm talking about professionals, so whenever you're taking any voice therapy, you should take the people, those who are certified speech pathologists, speech therapists, or speech language pathologists. Healthcare quacks may sometimes damage your voice and vocal cords. So whenever you are going to take voice therapy, speech therapy, please check the credential of the person who is going to give you the therapy, like from which college he has studied, what degree he has, in which year he passed out. He's registered in the, like if he is from India, he is registered in the Rehabilitation Council of India or not. So this information will, once you explore, then you can find the difference between the real speech therapist and the healthcare quacks. So I always try to create awareness among the society, or I can say in whole world, how a certified speech pathologist changes the life of people having communication disorder, and how you can differentiate the real speech therapist or certified speech therapist or any healthcare quacks. How you can differentiate. And apart from correcting the like pitch and loudness problem, we also provide voice therapy for the people having the fluency issue like stammering, and those people having the like suddenly the voice has gone completely. We call it the functional phonia. For them also we provide voice therapy. And we also provide voice therapy for the people having dysphonia due to the vocal cord paralysis. So once you will explore, those who are watching this live, my suggestion is, once you explore our YouTube channel's playlist, you will find the different kind of communication disorder pre and post treatment videos playlist. Like you will find the playlist for the stammering, you will find the playlist for the puberphonia, you will find the playlist for the pitch and loudness problem, you will find playlist for the sulcus vocalis, pre and post treatment video. You will find the phonatory gap patients pre and post treatment videos playlist, and you will find functional aphonia, and you will find stroke patients, the communication problem which occurs, we call aphasia, pre and post treatment videos. You will find pronunciation problem pre and post treatment videos. So that will help you to understand how a certified speech pathologist changes the life of people by correcting their communication problem. So if you are able to find the change in the Kent voice, please, again, I'll be requesting all of you, those who are watching this live, please subscribe our YouTube channel, share this video, so that people like Kent, who are having the communication problem, can reach to a right place like a certified speech pathologist. And yeah, so I'll be discussing any questions are there. So meantime. So those who have joined this live, again, I want to say thank you. Thank you, Salman. Thank you, Vishal. And thank you, Rishabh Sharma. And so I think one question I was getting about the medicine and all. So I'm a speech language pathologist and voice therapist, audiologist. I'm not expert of medicine, so I don't give any medicine to any of my patients. So what we correct the problem by voice therapy, technically we call it, and for Kent case, those who is live with us, we have corrected by online voice therapy, or we can say in a simple word, tele-rehabilitation or online voice therapy. So of course, I'm not a physician. I don't give medicine. I don't do surgeon. I'm not a surgeon. I'm a speech language pathologist. So I provide my services in the form of voice therapy, speech language therapy, speech therapy. That is a non-surgical procedure. That is without medicine treating the voice disorder. So don't get confused like I provide medicine. I'm not expert in medicine. Okay, and there are some questions. Some people newly have joined. Abhishek Kale has joined. He's saying, hi sir, hi Abhishek. So hi everyone for joining us and watching us. And those who want to contact us, please refer the description of this live, and you will find our website. And on website, you can click reach me, and then you will find our contact number, email ID on the Google map, where is our clinic situated. So all the details you will be able to find. So those who have joined newly, for them, information is today we are post-treatment live with Kent, and Kent is not in India, and we did his pre-treatment live earlier, and the description we have given in this present live. So please refer the description of this live and try to watch his pre-treatment live also. And today we are post-treatment live. So Kent, again, you can tell what was the problem and how do you feel? There are some new people who have joined. So can you tell again? Means I want you to people should hear your voice.
Yeah. So I'm 24 years old this year, right? And my voice hasn't changed, right, too much, like since I was 14 years old. And I was speaking with a very high-pitched voice, and that really troubled me, right? And like at the beginning, I didn't think this would make any difference until I started working. You know that it's very important that you speak with authority. But especially when you have a few people under you, like that you manage and that you supervise, right? It's really important to have a strong voice so that they will listen. And that really, that's the reason why I decided to get Dr. Sanjay to treat my voice, and it has been great. The treatment, I think it went well, and my voice has changed since then. Since the therapy started, and I'm very happy with my voice. I'm still doing whatever Dr. Sanjay taught me, and I think it'll be better.
Yes,
very soon.
because there was a lot of huge gap also in your treatment because you shifted from one place to the another place. So the therapy was not continued very systematically. But my plan is, sorry, therapy was not done very systematically because you shifted from one place to the another place. So I'll be giving few more sessions to get better confidence. But my idea was because we have done the pre-treatment live earlier, so let's do the post-treatment live and let my YouTube channel's fans to see your the changes in your voice because it was a long delay. Okay.
Yeah. And I don't have to force myself to speak deeply. It just become a behavior.
Yes.
It just become a habit for you to speak with a deeper voice. Yeah.
Yeah, it's a very good information you shared. Like in our therapy, we don't teach the patient to do mimicry or produce the voice artificially. After therapy, we teach everything to produce the voice in a very natural way. Instead of putting effort, everything comes very naturally. And thank you everyone, those who are joined and watching this live. And there are so many people watching. And if you have any question, feel free to ask and I will try to give the answer. And yeah, there are some questions coming. So let's discuss. There is a one question Vishal Thakur is saying, that is in Hindi. किस एज तक ठीक हो सकता है हाई पिच वॉइस? बहुत ही अच्छा क्वेश्चन पूछा है विशाल ठाकुर। अभी तक हमारे क्लिनिक में 55 इयर्स एज तक के लोग आए हैं जो पिच एंड लाउडनेस करेक्शन के लिए, और इनफैक्ट हमने 55 इयर्स एज में भी करेक्ट किया है। टिल नाउ एट आवर सेंटर द person up to 55 years age who came to our center and we treated successfully. And for creating awareness, I'll put that video in the comment box so that people can watch also, or in the description. And so highest we have treated 55 years age person who was having pitch and loudness problem. And Srilata Shimdari is saying, sir, I was diagnosed with the left vocal cord palsy in April. Will it be curable? Srilata, we have seen good changes in vocal cord paralysis once we have given the voice therapy in many cases. So I'm optimistic for you also. Voice therapy should help, but once we'll try, then we'll get the better answer. So you can contact us, and our contact details are in the description of this live. Our website you will be able to find. On website, click the reach me, you will find our contact number, email ID, and on the Google map where is the clinic situated. So please contact us and we will guide you after the perceptual evaluation, and you can also share all the medical reports, whatever you have, by email. And next, Rakesh Rocky is saying, sir, I mild stammer, please tell me how to overcome from the stammering. Yes, Rakesh, speech therapy may help you, and we have seen improvement in case of stammering also after speech therapy. One thing I want to share, there is no 100% cure of stammering. Then why the people come to my clinic? They come to improve. Like if the dysphalancy was more after therapy, dysphalancy will be less. But there is no 100% cure for the stammering till now what I have learned. Can you come to the little left side, like your yeah, that is so my I'm expecting speech therapy will be helping Rakesh Rocky to you, and we have seen treatment efficacy in case of stammering. Suppose if 100 people are coming for the speech therapy at our center, we have seen good changes or some significant difference among 80 people. There may be 20 people, they will think that it was wastage of time and money. So you can be anyone, either part of 20% population where you will feel there was no change at all, and you can be part of 80% population where you'll find some changes. But 80 is more than 20, so hope is more. So for stammering, we don't have 100% cure in our center, but we help people to communicate better. And even there is a one Hindi movie actor. He's very famous. He's also having this stammering. He took speech therapy from professional like us when he was child, and till today also he takes the help of his speech therapist, and he's better and he's success in his acting. So of course, speech therapy help. Okay, and there is a one thing. विशाल ठाकुर इज सेइंग मेरी आवाज़ बोलते बोलते कर्कश क्यों हो जाती है जबकि मुझे हाई पिच वॉइस प्रॉब्लम है. So Vishal Thakur, it's very difficult to understand all the details of your problem. Please refer the description of this live and you'll find the contact details, and please call us. We'll do the perceptual evaluation and then accordingly we'll guide you. If needed, we'll suggest some test, stroboscopy or laryngoscopy or any other test. So first step is to perceptual evaluation. So tomorrow you can call. Our call center is working between 10 a.m. to 7 p.m. from Monday to Friday, and on Saturday 10 a.m. to 5:30 p.m. Sunday and the public holidays, we will not be able to pick the call. Okay, so thank you everyone for joining us and watching us, and those who have joined newly, the information is we are post-treatment live today. Today Kent is with us, and today date is 5th August 2021, and we did his pre-treatment live earlier on 28 May, I think, and today we are after treatment live. And Kent was having some personal issues and relocation, so he was not able to take therapy very systematically, so that's why it has taken a little more time. But in all cases, that much time doesn't take. We have seen in our clinic those who come physically at our center, 8 days is very common during correcting the pitch and loudness problem. And during online therapy, I am seeing 2 weeks is very common. But again, I will be telling there is no universal rule. Person to person, therapy duration may vary. Because health science is not like mathematics, 2 plus 2 is equal to always 4. Okay, so Kent, can you tell again what exactly problem you are facing earlier and how do you feel after the treatment? And again, I'll play your pre-treatment live also. Okay, so now you tell how do you feel after treatment?
So I suffer from a high-pitched voice, and voice is actually very important. Okay, I didn't realize that, until like last year, right? It really affects your work, your relationship, and your attractiveness, in general. So the reason I went to Dr. Sanjay was because of my work. Okay, I want to do better at work, but I thought a high-pitched voice is gonna be a barrier, it's gonna hinder me, from progressing. So I went to Dr. Sanjay to cure my voice, and I'm happy that it has changed, and my voice is better now, better than before.
Okay, thank you, Kent, and I'll play your pre-treatment live just for a few seconds again. So I'm going to play that live we did on 28 May again. I'll be playing. I'm playing this.
Put me on speaker. From the other side, I can hear my voice. I didn't know that was my voice.
So this was your pre-treatment live, and that I played in between also, so that people can differentiate the changes. And it's getting stuck. Sorry. Yeah. So I think 10:30 I had a plan. So now 2 minutes is left, 2-3 minutes. So we'll stop this live. And if any question, if you are having, please put in the comment box. In the next live, I'll try to give the answer. Thank you, everyone. Love you, everyone, for watching us. And thank you so much. Thank you all. And right. Thank you, Kent, so much for being live and helping me to create awareness about the communication disorder. Thank you so much.
All right. Thank you. Thanks.